I'm Brenda Kazire.
I'm Nancy Hireman. We're a couple of hospice nurses and we're teaching you how to take care of the hospice patient or anyone who is in bed, bedbound. We're going to right now teach you how to change a brief of the person who is in bed and is unable to make it to the toilet. This is a very complex process, and actually, to tell you the truth, this is our second take. The first time around it took 9 minutes, and that's what it's going to take when you really do this.
And that's 9 minutes with people who know how to do it.
Yeah.
This is complex, and we've done this a lot, so doing it the first time is kind of scary when you've not done it before, but you're going to be okay, and it's not going to be perfect, but it's going to be enough.
And you're going to just take your time. There's no rush. So the first thing, we've got our client. He's ready to be checked. The first time, Brenda's going to check his brief to see if it needs to be changed.
And always make sure the room is private, warm, and cozy, so that nobody comes walking in. The hospital bed is oftentimes in the living room. And make sure it's warm, because it's really uncomfortable to be cold.
And she's got all of her supplies right at hand. You want everything within your fingertips, including the trash cans, so you're not just full of things in your hand and no place to put it.
If you have wipes, great. I like to take the wipes, open them up, and pop them in the microwave for about 30 seconds, which warms them up. It's much more comfortable. Or you can use an old-fashioned basin of soapy water and a washcloth.
Very good. So she's going to check to see if he needs to be changed, basically. And some of the briefs have an actual, these days, have a little bar that shows when they're actually soiled. And it's really good to do this every 2 to 3 hours. Great time to change the position so that the skin is staying healthy as well. So here we are. She's ready to go. She knows he needs to have it changed.
These new briefs are really good, but these Velcros stick to everything. So when I pull it off, I tuck it there under itself so that it's not getting in my way.
She's going to lift it up, roll it into itself, so all the soiling is going inside, and it will be tucked down between the legs. We have a man here, so she's going to now start from the front and wash him really well, as much as she can reach. If it's a man, don't be afraid. You got to lift his penis up, wash around it, his scrotum, in all the creases. For a woman, of course, you're going to do the same thing, except you're going into the labia, and you're going to make sure you can really get them as clean and fresh as possible from the front before you start even turning.
And don't be afraid to use lots of wipes, and just keep tossing them as you go.
Remember, you're just taking care of them the way you would clean your own body. Okay, now we need to turn him on his side. So Brenda's going to pull him a little towards her, so that he won't be rolled right into the onto the other side of the bed or off the bed. And he's going to be rolled just like we taught in our other videos, bending the knee, using the shoulder, pressing towards the side. If you have a patient that is unable to support their own body, you can see how she's providing a pillow so he's nice and comfortable. She's going to bolster his upper back so that he's comfortable, and that position can be maintained while she does her work.
And hospital beds often have side rails, half rails that go about here that are up that they can hold on to.
Now she's going to go ahead, his buttocks is exposed. She's going to clean off all of the skin. This is a great time to really inspect that skin. You've got to spread the buttock cheeks, because that's the first place that there's going to be skin breakdown. And it's a very, very common area. You don't want that to get started. So this is a great time to really look at the skin. Now, you notice how she's she's lifting his leg to get in all the creases. If I was there to help her, I would be standing where she is, lifting his legs so that she doesn't have to do all that work of the weight of the leg and the cleaning. But she's by herself, so she's going to complete that task. Now she's cleaned him as much as she could from this side. She's going to roll that soiled brief so that nothing oozes out. She's getting it as tight as possible and tucking it under his buttocks. Okay, now if the turn sheet was also soiled, she can roll that in. We need a whole new change here. All right, so we're going to get a new turn sheet. Again, this is just like putting the turn sheet under Dan for the first time. She's going to open it all the way, and everything's going to be rolled towards the center.
Making sure that the tabs are facing toward the head of the bed, the head of the patient.
There are tabs on both ends, so don't forget to open them both. There you go. Now she's got it halfway. She's going to roll it towards the center.
And here's the tricky part. Okay, now it's in the center. I don't want it too high up his back. I want the top of the brief right about his waistline.
Now she's going to take that cleaned one, and it's actually going to go all the way under everything that's dirty. This is really important. And you're telling the patient, you're feeling a bump, you're feeling a big ridge, we're getting ready to turn you on your back, you're going to have to roll over a big bump here.
Here's the old one. The new one is tucked under there. Okay?
Just spread it out. Now she's going to say, Dan, we're going to turn onto your back. There's a big bump that you're going to feel. And she's going to guide him onto his back. And if possible, roll him all the way to the other side in one motion, if possible. Good. And he was able to help with that.
Good.
Now we're going to dispose of all of the dirty. I'll help Brenda right there.
Having that garbage can right there.
And she's unrolling all of the cleans. So now she's got a totally clean surface. She's going to finish now cleaning his buttocks. Perhaps there was some stool or urine that was on this side, so now it's time to get it from this side. Again, look at this hip, look at this buttocks, look into the cheeks. Is there anything that's broken down? If there is, time to talk to your hospice nurse about what to do further. Sometimes this is a really good time to put ointments or lotion onto the skin. Liberally to protect the skin from the moisture.
Pulling this bottom piece through helps.
Yeah, so now she's ready to turn him onto his back, and we've got the clean brief all ready to go.
This is important to pull this, get it nice and snug, and you have to get it up in between the creases in the legs. You have to make sure that that's comfortably in the crease of the leg.
It's also going to prevent any leaking once more urine or stool comes through. And now she's going to use those Velcro tabs to make it snug, but again, don't overdo it and make it really tight because you can have skin breakdown and actual sores that develop from the elastic if it's too tight. So she's just checking to make sure it's not too tight. Okay, he's clean, dry. Now, if he needed to be changed, his position needed to be changed, she could either get to the head of the bed, pull him up a little bit higher like we've shown in the past, or have another caregiver or the friend use the sides to reposition him so he's comfortable. Good job, Brenda.